We Must See Our World Better by Debbie Swarthout. The target audience for this data analytics presentation is the public health policy makers at the World Health Organization. Data presented here were extracted from the data collections by the World Health Organization's Collaborating Center at Imperial College in London. The collaboration has data on more than 2,545 population-based surveys from 193 countries since 1957, with nearly 129 million participants. Diabetic retinopathy is associated with lesions in the blood vessels in the retina of the eye. High blood sugar levels in diabetic patients cause the defects in the blood vessels, which reduces oxygen flow to the retina. Retinal cells will eventually die and cause blindness. While timely laser surgery can prevent vision loss, reversal of vision damage associated with the proliferation of diabetic retinopathy is impossible. This means that people diagnosed with diabetes will require eyeglasses to correct their vision sometime in their life. This predictive need begs the question whether we can delay the onset of type 2 diabetes through healthy diet and regular exercise. It is a known fact that exercise reduces blood glucose levels substantially because it is used to power muscle contraction instead of being stored in fat cells when muscles are inactive. A change in body mass index can be caused by an increase in muscular mass due to frequent exercise, or it can be due to an increase in the accumulation of fat associated with the lack of daily exercise. If a positive association between diabetic prevalence and body mass index exists, this may indicate that lack of enough daily exercise may be one of the primary drivers of an increase in diabetic prevalence. The implication is that the lack of healthy daily diets and exercise may lead to increases in diabetic retinopathy in global populations in the future. This data analytics project visualizes the diabetes prevalence and body mass indices in men and women in the global population data available at the NCD Risk Factor Collaboration Project, hosted by Imperial College in London. The goal is to unravel a story on changes in diabetes over time to obtain a glimpse of future vision care needs in our rapidly expanding USA and global populations. Let's start by looking at what are the global trends in diabetes prevalence. The next visualization shows how the area density distributions for all countries shift to the right along the x-axis, depicting the overall increase in median diabetes prevalence in all 195 World Health Organization countries over the preceding 3 decades. Next, we may ask which health organization regions showed the highest increase in diabetic prevalence between 1980 and 2014. The next visualization shows that the largest proportional increases in diabetes prevalence occurred in the Eastern Mediterranean, Southeast Asian, and African regions. Overall, the highest changes were recorded in the Middle Eastern and Northern African countries. Of interest, we may ask, is the increase in diabetic prevalence associated with an increase in body mass index in specific World Health Organization regions across the globe? Analyzing the data from 2014, the next visualization shows a strong positive association between diabetes prevalence and mean body mass index among the World Health Organization countries in the African, Eastern Mediterranean, and Western Pacific regions. Based on the overall number of diabetic adults in 2014, we may ask which countries are going to have the highest eyeglass needs associated with diabetes-related vision defects. Data analysis show that China, India, and the USA had the top 3 highest number of diabetic males and females in 2014. Trailing behind those 3 countries, Japan, Pakistan, Indonesia, Brazil, Bangladesh, Russia, and Mexico make up the top 10 countries with the highest male diabetic populations. For females, the trend is similar, except Egypt replaces Bangladesh in the top 10 countries with the highest diabetic populations. It can be concluded that these countries are going to experience the highest demand for diabetic-associated vision care needs in the near future. Of interest, we may ask, what is the comparative change in diabetic prevalence between men and women in China, India, and the USA? We find that the rate of increase in diabetic prevalence is higher in men than in women in all 3 countries. This suggests that diabetic-associated vision impairment will be higher in males and the need for male eyeglass frames will increase over time. The increase in demand for female eyeglass frames will lag closely behind those of males globally. Based on this data analytics project, we can conclude that in the future, it appears that there will be very large demands for vision care as diabetic prevalence continues to increase with increases in body mass index across the globe. A begging question remains: how are we going to slow down the increase in diabetes globally?